If you're struggling to lose weight, you've probably heard about weight loss medications like Wegovy or Zepbound, and you might be wondering if they're right for you. Meet PlushCare, a leading telehealth provider with doctors who are there for you day and night to partner with you in your weight loss journey. If you qualify, they can safely prescribe you medication from the comfort of your own home. To get started, visit plushcare.com/weightloss. That's plushcare.com/weightloss. plushcare.com/weightloss.
Hello and welcome to Bytes of Health, where we hope to take a bite out of your parent worries each day with sound advice and guidance. Every morning, we'll answer a commonly asked pediatric question in 5 minutes or less. I'm Dr. Jess Steier, a public health scientist, and today I am solo answering a very important question. All right, today we are going to talk about hand sanitizers. The clock is ticking, so let's get to it. So hand sanitizer has become a staple item in many of our bags, cars, and pockets. But when can and should we use it? Let's discuss. So remember that hand sanitizer is not a true substitute for hand washing. Washing hands with soap and water is the single best way to remove germs. Hand sanitizer does a good job, but fails to remove certain germs and pathogens such as norovirus or C. diff, which causes severe diarrhea and colitis. Sanitizer also shouldn't be used on hands that are visibly soiled. It just won't be as effective. When soap and water are available, it's best to opt for hand washing. However, as parents, we don't always have access, and hand sanitizer is certainly better than nothing. It's a good idea to use hand sanitizer before and after visiting a loved one in a clinical setting, such as a nursing home or hospital, though not if they are sick with C. diff. All right, let's answer some questions. My child's daycare asks us to keep hand sanitizer in their bag. What alcohol percentage should I look for to make sure it's effective? So to effectively kill most germs, choose hand sanitizers with at least 60% alcohol if using hand sanitizer. Remember, it's important to use one with alcohol. So again, at least 60% ethanol, also known as ethyl alcohol. Sanitizers with a lower alcohol concentration or non-alcohol based hand sanitizers may not work equally well for many types of pathogens and merely reduce the growth of germs rather than kill them outright. Alcohol-based hand sanitizers kill germs quickly and in a different way than antibiotics. Using alcohol-based hand sanitizers to clean your hands does not cause antibiotic resistance. So is using hand sanitizer a good substitute for hand washing with soap and water? Again, hand washing with soap and water is always the best defense against germs, especially for young children. But hand sanitizers are a good alternative when soap and water aren't available, but they shouldn't be a primary replacement. Sometimes my child uses hand sanitizer and their hands still feel sticky. Does that mean it's not working? So stickiness can depend on the ingredients in a specific hand sanitizer, not necessarily its effectiveness. Make sure your child rubs the sanitizer all over their hands until it fully evaporates for best germ-killing action. I've heard hand sanitizer doesn't work against everything. What kind of germs are hand sanitizers not effective against? So again, alcohol-based hand sanitizers are not effective against certain types of pathogens like norovirus or stomach bug. This is why hand washing with soap and water is so crucial, especially after potential exposure to vomit or diarrhea. Hand sanitizer is readily available everywhere now. Is there any danger of my child using too much or accidentally ingesting it? So it's important to supervise young children when using hand sanitizer to prevent accidental ingestion. While useful, hand sanitizer does contain alcohol, which can be harmful if swallowed. Store it out of reach and emphasize that it's only for cleaning hands. The FDA regulates hand sanitizer as an over-the-counter drug available without a prescription. They have discovered some serious safety concerns with some hand sanitizers during recent testing, including contamination with potentially toxic types of alcohol, not enough of the active ingredient, which again is either ethyl alcohol or isopropyl alcohol, or labels with false, misleading, or unproven claims. Some hand sanitizers have even been recalled, and there are more than 150 brands the FDA recommends that you stop using right away. You can check the FDA's Do Not Use list at www.fda.gov/hand sanitizer list. All right. Well, I hope you learned something today. And remember, we have lots more to share. If you like what you've heard here, let us know. Please leave us a review on Apple and be sure to tell your friends. Remember, there is no single or best way to parent. Parenting is a journey, and we are all just doing our very best. We wish you happy, healthy, and stress-free parenting.
As a longtime foreign correspondent, I've worked in lots of places, but nowhere as important to the world as China. I'm Jane Perlez, former Beijing bureau chief for the New York Times. Join me on my new podcast, Face Off, U.S. versus China, where I'll take you behind the scenes in the tumultuous U.S.-China relationship. Find Face Off wherever you get your podcasts.